Thank you, Kevin, and it's just so nice to be here today. This is a big moment for me. Have never been here before, so I hope you enjoy the day. So as Kevin said, I look after the research programme in the All-Ireland Institute of Hospice and Palliative Care. So I actually know quite a lot of you here, so I hope I get to see you later. So I just wanted to give you an update around the Palliative Care Research Network and also the Early Career Researcher Forum and what has been going on over the last year. What are our priorities and plans? We have a strategic plan in place. As Kevin mentioned, we have the Strategic Scientific Committee, but we made this plan in collaboration with all the key stakeholders. So we're kind of like, 24. So we've a year done, 23 and 24. Where are we? I'm going to talk a little bit about the priorities for 2025 as well and give you an update on this year. So the PCRN vision is that it's the lead-in network for palliative care across the island of Ireland, and that it's involved in internationally recognised research that enhances palliative care knowledge and expertise, and most importantly, improves the quality of life of people with life-limiting conditions, and also improves the quality of their death as well. The strategic plan has a number of priorities, collaboration being top there. Also that creating of an academic clinical environment. Karen mentioned how the Institute has a number of members across the island of Ireland, and we're delighted that we have our hospice and palliative care provider members and from the trusts here today as well. It's very important that research embraces that as well. We are very much trying to support those early career researchers, delighted so many of them are here today, and support the mid-career researchers as well, those who are looking to lead in the area. Involving people with life-limiting conditions, family carers and the citizens is key to the work we do. We're delighted that there's so many voices for care members here. And we want to maximise always the research impact on practice and policy. We don't want the research to sit on a shelf. So what are the key highlights of 2024? One of the key ones was we had 5 new PCRN members across the island. Dr. Deborah Muldrew in Ulster University, Dr. Jeffrey Hanna in Ulster University, Dr. Stacey Power-Walsh in University College Dublin, Dr. Carolyn Blair in Queen's University Belfast, and Dr. Natasha Bradley in Queen's University Belfast, who has also moved to the University College London now. But I just wanted to say these were all members of the Early Career Researcher Forum. So those of you that are here today, this is where we would like to see you on this list at some stage in the future. And the important thing as well is in the Early Career Researcher Forum, we welcome 30 new members, again, from across the island of Ireland. One of the key things we did this year is we set up the pilot special interest groups, and we're delighted some of the chairs and vice chairs of those groups are here. Those groups are to support collaboration in specific topic areas. They involve both the Palliative Care Research Network, Early Career Researcher Forum members, but along with Voices for Care members, health and social care professionals. We have industry partners as well in the technology one. So it's very much an open space for people to collaborate. And if you go to our Palliative Hub professional, and we'll give you the details of this after the conference, you can join up to one of the groups if you're interested. They're in 3 areas: dementia and palliative care, psychological, social and spiritual care group, and the technology and palliative care. For the Technology and Palliative Care Group, there are 35 members at present and growing all the time. Some of the things they're looking at is energy hardship and technology, wearable devices and pain management, virtual reality in palliative care settings, and what type of technology would be suitable for people at home. They've done a webinar quite recently on virtual and augmented reality, and they are having an event in February to March that we're supporting in the Walton Institute in South East Technological University. That is a centre of technology excellence, if you like, and really we'll be inviting everybody to come along to that. So the other group we have, and we're delighted they have supported the theme, and we're on the organising committee for, and we have the chair and vice chair here today as well of this group. So they have, and I won't steal their thunder, but they've 37 members to date. They have done a survey, and we're delighted that Dr. Barry Quinn and Dr. Niall Galligan are going to be given the results of that around spiritual and psychological care. And they've been involved in a number of different things, including the theme for today's symposium. Dementia and palliative care as well is an important area. There's 25 members. These are really looking at people with advanced dementia and how they can support them. One area of really key concern for them is the emergency room admissions for people with advanced dementia, and how getting different sources of data that really that can be looked at from a research perspective to change the way that happens in practice. We're also linking in with the Institute is involved with the CARU project, which is supported by the HSE in the Republic of Ireland, and it's a nursing homes education and support programme. Then I suppose another thing we did this year, and we're delighted, as I said, we had the hospice and specialist palliative care providers here because they were very good, and they filled out this survey that I know myself and Karen were saying, please fill this out, because we wanted to get an understanding of their research activity and if they were interested in it going forward. And as you can see, we had quite a lot across the island of Ireland involved. 12 were research active, but 5 are interested in getting into the area, and they're all interested in doing more research. There are some barriers around resourcing, research knowledge, the organisational culture, but there was 36 ongoing projects, and they're across health services, cancer, patient experience and decision making. They're doing observational and intervention-based studies. Some are not funded, so they're trying to in-house fund or get external funding. It's a key area where we want to ensure collaboration between the Palliative Care Research Network and Early Career Research Forum to support the clinical sites, and that's something we're looking at, and they have a number of outputs, as you see. And then following that, we had an event in June 2024 for across the island of Ireland with keynote speakers, and we really workshopped, well, what would be the enabler for involvement? One of the things that came out quite strongly was having a research lead and on-site support. I know we have one of our former research nurses here from Marie Curie. This model was really looked at and said if you have a dedicated person, they want to increase the academical clinical post. Some of the members of the new PCRN members, Jeffrey Hanna is an example of somebody who's an academic clinical post. It's a key role. We want to have more of them, protect time, streamline processes, and have a common agreement across the island of Ireland about multi-site engagement. Start doing projects together. This is a very underfunded area. We're very grateful for all the support from the HRB, HSE, R&D, PHA and other funders. Internationally, it's an underfunded healthcare area. It's no different on the island of Ireland, so we're trying to manage those resources as wisely as possible. We also, my colleague Jane Clare was very busy hosting webinars with our PCRN and ECRF members across a number of topics, and we also had that event. We had 262 participants across all of these events, but we also put all the recordings up on the Palliative Hub professional site, and we have had many, many more views of them up there because, you know, we're in an area where people find it hard to get away from clinical work or academic work. Involving people with life-limiting conditions, family carers is key to the work we do. We were delighted to have our members. We had John Joyce, who's here today, involved in the energy hardship launch there on the left, where we looked at energy hardship for people with palliative care needs. It's been a mild winter so far, but we're very concerned about what might come and how we can support those people. And the other, we have Will Higgins, an example, who chaired one of the PPI panels at the Ireland Research Active Hospice event. We've also supported the development of draft PPI impact evaluation framework, and that's another key area we're looking at. What is the impact of voices for care involvement? Our researchers are very key in impacting policy. These are just 2 examples. There are many more across the island of Ireland. Professor Karen Ryan here with the Minister for Health in the Republic of Ireland was involved in supporting, chairing the consultation committee around the new adult palliative care policy, but also supporting with research evidence, along with our other PCRN member, Dr. Bridget Johnson, as well from Trinity College Dublin. And as I mentioned here, we have researchers from South East Technological University who are involved in this energy hardship report. So there are many examples across the island, just chose those two. We also have on the PAL Hub, where we are promoting the research projects of our members and also their publications and other outputs. So if you're not there, do let us know. So what are the priorities for 2025? That collaboration is key. We're looking at setting up 2 other special interest groups, one in underserved populations. Delighted one of our keynote speakers is here today, Audrey Royalston, who is involved in supporting the development of that group. So that will be set up in 2025 to look at people who are homeless in prisons, intellectual disabilities and other areas. We're going to support the update of the All-Ireland Top 10 Research Priorities with the support of Marie Curie UK, and we are, fingers crossed, if all the funding comes in, we're hoping for, we will be in a position to support with PCRN fellowships this year, to support our PCRN members to go between the island of Ireland and internationally for maybe a month or so to build those connections. We want to establish a community of practice for clinical site research. This is so that we can support the hospices to develop capacity and capability, working hand in hand with PCRN and ECRF members. Again, with the little asterisk, that's if all the funding we have on the table will come in, and we're very hopeful. We want to make sure we've links to this clinical site research. To develop our next generation of palliative care researchers, it's very important to get funding in place, not only for PhD level to start them, but also at postdoctoral level to get that mid-career research a real boost. So we are looking at programs and we're working on that at the moment. And we have a lot of our senior PCRN members here today who are in the background doing that. We are looking as well to support the early career researcher forum members with bursaries so that they can go to conferences, but also fellowships so that you could spend some time in the north if you're from the Republic of Ireland, or in the south if you're from Northern Ireland. So to make sure we foster that all-Ireland collaboration. We're going to implement the PPI impact evaluation framework, and we're also really going to support an in-person event, and my colleague Paula is here as well today. We've been talking about this to promote the equal involvement of people with palliative care needs, family carers, or Voices for Care members in research. We are very interested in making sure that we can, or the research impacts policy and practice. I know I was talking to Professor Sonia McElfatrick this morning. She was on about this very thing about case studies. So we're really looking at those. That's a key area for us. But we want to support the development of effective practice and policy briefs. We're delighted that some of the policymakers, like the Minister for Health, was here this morning. And we also have Rory Higgin here from the Department of Health in the Republic of Ireland. So we really want to hear how we can support them more in what they're trying to achieve. This is just some of the areas. It's not a comprehensive list, but just for those who weren't aware, our members are working across decision making at end of life. They're helping in service planning. They're helping in symptom management. They're looking at children's palliative care. That is also a very important area, and other areas as well. And they're funded across a number of different organisations. They're also involved in international projects. We're delighted that Cathy Payne is here from the AIIHPC, who is a former colleague of mine in the Institute, and they're really supporting that, getting funding from the EU and sharing it. And these are across the island of Ireland. So the dyadic is psychoeducational interventions for people with advanced cancer, and this is coming to an end. The Better B studies for breathlessness at end of life. Again, these involve our PCRN members. This is really important research. They've come up with some very good clinical insights into that. And one really good, example of it is this one. It's called In Touch. This built up on the My Support collaboration that was led by Professor Kevin Brazil from Queen's University and involved Professor Nicola Cornelli from UCC. This is a great example of mentoring in work. Professor Nicola Cornelli then led on the In Touch, which is a follow-on from that, and Professor Kevin Brazil in things. So it's about that handing in supporting each other. And then just finally, before I finish today, I would just like to acknowledge our dear colleague, Marion Lovett. Marion was with us for a very short period of time, but she made an impact. And I know I've even, some people, have said some really nice things about her in that short space of time. So there's some of the photos. She joined us at an event in June. She just started with the Institute, so I just had met her for the first time then. And I just thought there was some lovely photos from her in action. And she was with us till August. So we're just thinking of her family today and thinking of Marion, and I know she's with us in person. So finally, I would just like to thank you all for your attention, to say please log on to the Palliative Hub Professional and see the resources we have there. Let us promote your research. And for further information, myself or my colleague Jane Clare, she's going to be talking to you later, and that's her photo. So thank you very much.